It's my great pleasure to invite on stage Andreas Hofer, expert in microbiology and molecular epidemiology at the European Centre for Disease Prevention and Control.
Thank you for that introduction, Martin. I'd like to start off thanking the organizers of ESCAIDE. This is, I think, my 6th time at ESCAIDE and first time speaking. So I'm speaking after all the distinguished guests and the panel just now and right before the coffee break. So thank you very much for that. On behalf of the ECDC EURL team, I'm going to present a little bit on the new EU reference labs for public health. I think it's always a bit too early to talk about public health microbiology, so I'm going to try to keep this quite quick and quite light, which is why we'll start with the legal framework, which we'll go through in quite a lot of detail. No, let's not do that. So in short, based on the new regulation, the Serious Cross-Border Threats to Health, we have an Article 15, which gives us the privilege of establishing EU reference laboratories for public health in close collaboration with DG Sante. These reference labs, hopefully, will do a lot to address the uncertainty that Silvio just mentioned. But specifically, they're going to be performing a lot of tasks on reference diagnostics, scientific support for the member states and also ECDC. They'll be doing EQAs. They're doing a little bit of public health research as well, some large-scale seroprevalence studies, and a lot of capacity building, both online, in-person, site visits, twinning visits, and everything. So I think that's going to be very nice. So just here we have the first 9 EURLs designated in 2025. We had 6 start, and then in 2026 we'll have 3 additional ones coming. But what this really shows is like kind of a very strong and long-term commitment for public health microbiology strengthening from the Commission side, which is very promising. These EU reference laboratories are all kind of their consortia established between single centers or up to 5 consortium members of public health, national public health institute, and institutes that are already demonstrated their excellence in the field. So here we have the first 6 EURLs on the left that have started in January 2025. I'd like to take a second to give a huge thank you to these first 6 EURLs and all of the consortium members that have worked on this. Anytime we shift from kind of a previous system to what we have now, there's a lot of lessons learned, not challenges, but lessons learned. And I think the dedication that they've shown, the effort, and the tremendous outputs that they've had so far are really commendable. So it's very, very nice. In January 2026, we have 3 additional ones starting. These are the food and waterborne EURLs. Then we have the respiratory viruses starting in January 2027, and then we have 4 more EURLs starting in January 2028. And we're already talking about the additional EURLs that we're going to do. Another thing that I think is very nice about the way that we're doing these EURLs now is part of ECDC's kind of job with the EURLs is to coordinate the network of EURLs. So what we're doing now is all of the EURLs and all of the different fields that we've shown, they meet very regularly. We meet online. We meet once a year face-to-face, and we talk about the experiences that we have and the best ways to address, I guess, the uncertainties that Silvio mentioned and how to kind of perform this epic task of strengthening public health microbiology in the EU. So yeah, this is a great group, and it's been a pleasure working with them. So with that, there wasn't so much policy now. But with that, you're going to see these pins that we've been passing around to people that represent the EURLs. So please go ahead and ask them about the EURLs and what the EURLs can do for you as the stakeholders. We have a little flyer or a roll-up at the ECDC info stand as well. So come talk to myself. You can talk to my colleagues Max and Vicky about the legal framework, and then I can talk a little bit about some of the activities that we've done in the first year. And with that, I think I'm done. Thank you very much.